Hello and welcome to another episode of AGEUcational. This is Roy.
This is Terry.
So this is a fairly relatively new podcast, and what we aim to do is we want to put information out there for not only the aging but caregivers and those that are maybe getting closer to being seniors, that all kinds. We're going to have, we're going to chronicle our journey, mine and Terry's family, our parents, what we're going through. And then we're also going to bring professionals on. And we'd also like to hear stories of others that are going through things, that have made it through things. We want to be a good support group and put some information out there for everybody, just to make this aging process for yourself or your loved one much easier and a lot less stressful. So with that said, I'm going to turn it over to Terry. If you could introduce our guest.
Yes, we would like to welcome Dr. Carol Schweri for the second time. This is the first time on this podcast, but she was a guest on one of our other ones, and we wanted to have her back. She is a dedicated healthcare practitioner for over 40 years. Deeply committed to helping people who struggle with feeling sick, tired, and in pain. She likes to find the root causes of their health challenges, helps them reset their day no matter what their age. Through targeted testing, Dr. Shwery can assess how each system is working and design an individualized wellness program to rebalance your body. Dr. Shwery, thank you so much for coming and talking to us. We'd like to welcome you to the show and find out everything that we need to know about aging.
Golly gee. Okay, I don't know if I can say it that fast.
Let's go.
I can't talk that fast.
No pressure.
Well, thanks for having me back. You guys are wonderful, and I so appreciate being able to share what I can with you guys in a short and limited amount of time. And I know you wanted to talk about aging.
Correct.
So,
yes, we do.
All right. Yes, Terry, do you have something you look like you want to say?
Well, I wanted to say that you are a functional medicine practitioner. So maybe we can start there and just kind of tell a little bit what the difference between functional and regular. What is it?
Traditional.
Traditional. Thank you. Regular.
Yeah.
Let's go there.
All right. So the difference in a brief way is the difference between conventional medicine and functional medicine is when you go to see a conventional medical doctor, they're listening to your symptoms. They're looking at you from what I call the top down. Hi, I've got this symptom. And so what their approach is to go, okay, I want to eradicate the symptom. So we're going to give you their main MO or modus operandi is through medication and surgery. They're going to eliminate, that is their orientation. Functional medicine, we are going from the bottom up. So we're trying to find out, why do you have that symptom? What's wrong with you? So we're looking at trying to find root causes of why somebody has the problem and treat those rather than simply treating the symptom. So that's a difference of orientation. And it provides different type of treatment modalities. So what we're trying to do is understand in terms of functional medicine, we have many what I call foundations of health. And we're going to talk about those more today as we talk about aging and what we need to do. Does that help?
Yes, perfect. Thank you.
Okay.
Yeah.
Everybody jump right in.
Obviously, we're all aging. That is a statement of fact. We want to get healthy aging at no matter what age we are. I mean, so for some people, they think of aging as once they hit, 65, other people say, I'm starting to age at 35, 40, whatever, but we want that same principle. Okay. And so why is this important for us? What is the reason we want to be healthy? And I ask you, and I ask your listeners that. My why, I just turned 66, Yahoo, 3 weeks. So
I can't believe it. Happy belated birthday.
Thank you so much. So my why is, and probably yours, we have loved ones, we have grandchildren, we have people in our life we want to be there for. We want to live a life of joy and purpose. One of my main joys is I love gardening. I'm a master gardener. I want to spend hours a day out in my garden, and I want to be healthy enough to do it. And so what's your reasons for wanting to stay healthy? That's really important. And so what today, really the idea is, the best defense is a good offense. Okay, that's what we're really trying to achieve here. And so 90% of all illness is due to lifestyle, 90%. And so 90% of all illness can be fixed with lifestyle. That's a big statement.
Interesting. Yeah, it's huge.
I'm just looking at you.
Say that again. Let's let it. Say that again. Let's do it. Well, it's,
90% of all illness is due to lifestyle, and 90% of all illness can be fixed with lifestyle.
Oh man.
So that's a huge statement. So if you go to conventional wisdom medical doctors, that's not necessarily the direction they're going to be looking at. So the point is, we have an opportunity to control our health in far bigger ways than we ever thought. So we have this sense, there's a curve, a life. I gotta see. I can't remember the name of my curve. It's chronicling the health and decline of health, and there is basically a curve that around 40, our health starts to decline rapidly, and that's the traditional trajectory of health in our country. We hit a certain point, and all of a sudden things start to fall apart. And what we're trying to do in functional medicine is what I call rectangularize the curve. So instead of going like this and then, ooh, we want to bring the health and just keep it sort of in a rectangle until the very end, because we know we're all going to die at some point, but we don't want to have that trajectory really rapidly going downhill once we hit the 40s and beyond. So that's really what we're doing today. And we have ways in which we want to make that happen. And so my goal is to try and fix our health and fix our healthcare system so that we can do that. And we talked last time, and I want to talk again about the 8 foundations of our health. Okay, we've got nutrition, we've got hydration, we've got stress reduction, we've got exercise, we've got a toxic environment. We live around 85,000 different chemicals every week we can encounter, and they do affect us. We've got relationship issues, and this is something we're going to talk about. Well, we can talk about it right now. Seniors in this time of COVID. Do you think isolation has become a giant problem for seniors? Oh my God, it's horrible. It is, and that's a foundation of health. If we're not getting enough sleep, if we're too stressed out, or simply we're, aging, people when they age, especially if they're not living their health, their self-care is not the best. Sleep can be a problem. The nervous system can be ramped up and out of balance. And then are people getting as much joy in life, especially right now? These are the foundations of health, and it doesn't matter how old you are. But as we age, these things become older. I wanted to just say one thing. You guys know I have had, when I turned 50, I ended up with brain surgery. I had a tumor, 14-hour surgery, came out in a coma, came out of the coma totally paralyzed on one side completely, and had to relearn. And I learned what it meant at 50 years old to be old, because I was in a wheelchair with half a head of hair and an eye patch over my eye, and I got to experience life as an old person.
Wow.
And it was highly revealing from many points of view. And so I got a preemptive view of what it could be like, but it doesn't have to be like that. So it made my passion for wanting to help people even more important and real, because I really got a sense of this.
Yeah.
And so I want to talk to you about things that you guys and your people can do today that matter. Now, I'm going to ask
Okay.
both of you a
Awesome.
question. I want to ask you guys,
Oh,
what do you think?
The answer is no.
What do you
I'm
believe
sorry.
for either of you or your listeners is the most feared situation about aging health-wise?
well, I'll go first. I think it's outliving our wellness and being a burden on our family, or just being trapped, having a good fresh mind, but a body that, like you were saying, that maybe can't get out and garden anymore if that was your passion, or like me, I like to get out and hike, so if I couldn't go do that, that would not be good. So I think it's kind of twofold for me, is I want to remain active until the end, but I also don't want to be a burden on anybody else. They because we talk about that eventually, is that that's a huge stressor too, to have to be a caregiver to somebody who is in a mess. And then I guess the just taking that a little further is, then you think about it being self-inflicted. I mean, if you have an accident or something that happens to you is one thing, but as you begin to get to a certain age, you start thinking about, well, am I self-inflicting future trauma on myself? So now's a good time to think about getting my lifestyle cleaned up. I can say that for sure.
My answer is getting Alzheimer's. I mean,
Yes.
Definitely. And
Okay.
I joke about it all the time. It's not really just because I have a sick, twisted sense of humor, and that's the only way that I can get through. But my dad had Alzheimer's for at least a dozen years that we know of, for sure. And he passed away about 5 years ago. But I mean, it was just a long suffering, just to see his suffering, and our, part of it's selfish because he wasn't there. We just didn't see the twinkle in his eye. Alzheimer's for sure. But I joke about me, yeah, that's my Alzheimer's is kicking in. I shouldn't do that. I gotta stop.
But it's increasing in a really quick and rapid way. Alzheimer's and dementia are the number one concern of people who are aging. That is it. You hit it right on the head. So that's kind of wanted to talk about that today, but step back from that a little bit and go, well, why is that? What's happening here? Because that is the number one fear of everyone.
Is it?
Yes, it is. It is definitely number one. So with that, I want to say, well, again, going back to the functional medicine model, why is what is happening? By the 2050, the numbers are going to be triple and quadruple what they are now for Alzheimer's. It's rapidly increasing. So I wanted to talk about a few things. We have a short period of time, so I wanted to kind of just give you a sense. The first thing is Alzheimer's, dementia. These are functions of inflammation. Okay, so if we need to deal with getting the inflammation in our bodies under control, okay, inflammation is the number one cause of degenerative disease all over our bodies. And it's not just arthritis or the itises, cardiovascular disease, diabetes. These are all pro-inflammatory diseases. So we need to get our inflammation under control. Okay, things like Alzheimer's, diabetes, arthritis, autoimmune diseases, which are hugely on the rise, neurologic diseases, cancers, pulmonary, they're all inflammation. And what's another little secret side little information is belly fat. Okay, we think of belly fat as the belly fat you can see on the outside, but I'm talking about the belly fat that's underneath that fat. That is sending out pro-inflammatory signals in a big way. So we need to be able to go, and the same diseases, including Alzheimer's, can be triggered through the inflammation pathway, through that excess belly fat. So we need to be able to go, wow, what do we need to do to manage this? So for your listeners, I just want to say, okay, this is a driving force for aging, inflammation. And so what can we do to limit the inflammation? What can we do today? We can decrease inflammatory foods. Okay, that we can do today. These are common pro-inflammatory foods. You've got gluten-containing foods. You've got corn, soy products, dairy, sugar, eggs, peanuts. These are super common pro-inflammatory foods. Okay, these are things that anybody can manage right now. And just as an aside, gluten has been shown to be dramatically problematic for the Alzheimer's and dementia patient. So do you know what I mean by that?
I like my gluten.
I know, we all like our gluten. Yeah, we do.
So
yes.
No, go ahead. I was going to say,
Oh.
So what types of food? So
breads, pastas.
Yeah.
I mean, this is a large, a much longer, everything I'm saying could be another 2-hour conversation, but you can.
Right.
What's valuable right now is, I don't know I asked you this the last time. I mean, you've got a Whole Foods where you live, right? You've got health food stores.
Yep,
you can go and get non-gluten grain. Okay, non-gluten breads. You want to stay away from gluten. And I'll tell you, when I get heavy into gluten, brain fog is my immediate response. And this is not just, it does, a little brain fog, it leads somewhere. It has physiological ramifications. So these are things you can do to help yourself with fighting aging by changing the diet that you have. You want an anti-inflammatory diet. You can also take omega-3 fatty acids, okay? Because every cell in our body is made up of fatty acids, every cell membrane. So, and if you're deficient in omega-3s, then your pro-inflammatory potential is higher. So that's another thing you can do to fight off inflammation. And another little thing that you might want to consider is you want to eat 9 to 11 servings of fruits and vegetables a day. That's a tremendous amount. That's two giant dinner platefuls a day. So I encourage people to drink their fruits and vegetables. And especially for Alzheimer's, we say the term go blue, okay? Because blue, like berries, these things are super anti-inflammatory. So if you make yourself a drink, you put some berries in it, this is going to be really anti-inflammatory, which is going to be really, really good. I want to also talk about your guts. Your guts and your brain are linked. So if you have a situation in your gut where your gut is something called leaky, again, we could talk for hours about what leaky gut means, but it means that the membrane of your guts are so permeable that things can get through into your body that are not supposed to be there. Toxins, infections, all sorts of particles that are not supposed to be in your body. And guess where they can migrate to? They can migrate to your brain. So leaky gut oftentimes means leaky brain. Okay, so
wow.
This is super important when it comes to, as aging folks, our brain function. Leaky gut, leaky brain, oh my gosh, this is a big problem for those of us who are in the aging process. We want to make sure that we don't have that situation. So the other thing about the gut, one of the main problems with aging, especially now, is people are depressed. Okay, there's a lot of depression in the world. Well, believe it or not, 70% of all our neurotransmitter serotonin, you've heard of that, okay,
Yeah.
that's in the gut. It's in the gut. 70% is in the gut, not in the brain, in the gut. So if our guts aren't working well, then our moods can be greatly diminished. So again, how aging, it's not about, I'm going to go to the doctor and say, hey, this COVID's knocking me for a loop. I need some antidepressants. Well, that's an option. But the other option is, well, why is this become so bad besides the fact that we're living isolated? What physiological activity is taking place that can make this worse? So we want to think about the gut. And so again, the anti-inflammatory diet, the omega-3s, and if you take some, probiotics or probiotic rich foods, these are going to help with your leaky gut if you have it.
Okay.
And most of us do. And I just wanted, I'm going kind of quick. I don't know where we are.
Yeah, you're fine.
Is this good?
Can we talk a little bit about the probiotics? I mean,
Yes.
are there certain ones that are better? I mean, just a little view.
Well, this is a very large topic. This is a large topic, but
yes,
I would say, I mean, if you want to go, to the store, I believe probiotics is a very, the topic is really, the research on it is really growing right now a lot. But to get acidophilus, lactobacillus, acidophilus, and or bifidus is pretty basic, all-purpose probiotic for most people. And you want to, at least in my opinion, try and get closer to 50 billion per dose. Not million, billion. That would be just that would be a way to start the plugging of the holes if they're there.
Okay.
And I know we could talk about this for a couple hours on its own, but just two quick questions is, we'd have a previous guest on that we kind of got off on this, and they were saying that there is a prebiotic that it's probably a good idea to do a prebiotic to make sure you have the bacteria for the probiotics to eat. And then the other thing that she did mention was that it's better to get it out of a refrigerated case than off the shelf, just because of shelf life issues.
Well, prebiotics are different. Probiotics, you have to, well, this is the problem with this conversation. One of the things I encourage you to do is that when you go to the health food store, you can always get these from me, should you decide to, because I spend a lot of time researching the companies that provide these things. And part of the problem with probiotics is if they have not been tested to get through the bile in the gallbladder, it's like you're spending a lot of money for nothing. And so if you go to the health food store, you say, what has there been independent lab testing on your probiotics? And because if they haven't, you don't know what you're getting. Okay, now prebiotics are what the probiotics, which are really bacteria, it's what they feed on. Okay, so you can get prebiotics. You don't have to refrigerate prebiotics. And the way that certain probiotics are being created now, not all need refrigeration. But you need to go to the store and take due diligence and say, prove to me that you know that what's on the label is in the body. Where's the independent lab testing on this product? And if they look at you like you're crazy, then I wouldn't do it.
Okay.
Then you've done your job.
Well, I just feel like you got to go. I've gone in there just to see, and they go, what do you mean? I go, well, why would I do something if I don't really know that what's on the label is true?
Right.
That's important to me.
Okay.
But I did want to say about prebiotics. Prebiotics are foods, okay? So you can get unripe bananas, asparagus. There are a list of foods, but you can also, that you can eat, which are prebiotic in nature. But the other thing you can do is you can get a prebiotic resistant starch formula, which help you. You do not have to refrigerate that. You can go in and say, I'd like a prebiotic formula, which are just a conglomeration of foods, inulin. These are things that you can get to support the production of the probiotics. Okay. So you can go to the store and say, I want a prebiotic powder, a prebiotic formula. Or you can get the foods, artichokes, a leaf. These are prebiotic foods. Okay, so does that help you? Okay.
Yes.
Yeah.
Thank you.
Okay.
Yeah, and we'll invite you back to do a whole show on probiotics and prebiotics. I know there's a lot to cover, so we can move on. I just had those. I just
want this last idea. I really want you to, because I decided since dementia and Alzheimer's is the #1 concern, we really need to get to that. So the things that help promote that problem: diet, insulin, infections, stress, not getting the right kind of fats, exercise, sleep, social isolation. What does this sound like? This sounds like the foundations of health. But I want you to hear this one most important piece. What do you think the other title for Alzheimer's is? There's another title. You weren't going to know, so I'm going to tell you. Okay.
Yeah. Okay.
And Roy, you're not going to like it.
Don't make me mute you.
Don't make me mute you.
The other title of Alzheimer's is diabetes 2. That's what it's called.
Okay.
Okay, diabetes 2. Okay, because insulin, when there's a problem with insulin and how it affects blood sugar, we have discovered that it is a direct correlation to the incidence of Alzheimer's increasing. So if somebody has a problem with their blood sugar and their insulin, which is where the problems are with blood sugar, you don't have a problem. A person doesn't have a problem with blood sugar. A person has a problem with how their insulin is or is not being produced and where it puts the sugar in your body. So if we don't have our blood sugar handled correctly, we are prone to our potential of getting Alzheimer's is massively increased.
Okay.
So I really want people to hear that it's paramount to manage our blood sugar because we don't want to go down that path if possible. So how do we do that? We manage it with diet. And if need be, altering if we have to take nutritional supplementation to manage the blood sugar even more, because that may be a very strong possibility. And
what are some, again, I know we could get way off on this, but just what are a couple of nutritional supplements that can help with blood sugar?
Well, there's a lot of them, and I'm in the middle of having a total brain freeze right now.
Okay, no, you're fine. You're fine.
Licorice, but I'm trying to think of one thing in particular. Let me keep talking, and I'll wind back.
Yeah. You're fine.
I'm totally having a mental breakdown right now. Excuse me.
No, you're good. You're good.
Gosh darn it. Anyway, I'll think of it because I'm having.
Yeah. No worries.
I had some thoughts that I wanted to get the final few things. There's
sure.
BDNF, brain-derived neurotrophic factor. BDNF it helps increase our brain chemicals and brain connections, neuron connections. Exercise, vital for improving that. So if you find that you are, you want to not only improve our aging process, but our brain function, we got to exercise in order to do that. It's very important specifically for this BDNF increase. So, because if we don't, it's not going to work well. The
two things that you've mentioned so far, that the brain fog, definitely, when I eat wrong, not what I'm supposed to be eating, I can feel that. Some days it take 2 or 3 hours to you just feel like everything is moving slow in the brain. But then the other is the exercise. It's amazing how transformative that can be to get out and take a 15-minute walk, and it's like it's just like my head clears out, thinking so much better. Have a lot of great ideas to come back and share with Terry. And
well, the other thing is, like, one of the things since COVID, I've never sat in front of my computer. I've never sat down for my work. Well, I finally just last week got a desk that raises and lowers.
Right.
Okay, so I tell you, it's really fabulous, because on YouTube, you can find all sorts of 5-minute, 10-minute exercise routines for a standing desk. Okay. Okay. So, I mean, I don't know, do you guys have Costco out where you are? Do you have that? You do?
Yes.
Well, this came from Costco. Okay.
Yes.
And it just sits on top of my desk,
Okay.
and I can raise and lower it. And it's a way to get exercise even when you're sitting in front of your computer. So that's really, really important.
Interesting. Okay.
Okay. And then I just have two other things I want to say. Stress and the hormones that are produced in the stress in your body, they can pull apart your gut, they can make it leaky, and it also, your brain shrinks from stress.
Oh.
So we want to manage our stress level. One nutritional supplement way to do that is to take B5, B6, and vitamin C. These things, they come in formulations like that can really help your adrenal glands, because we don't want our brain to shrink, right? And so we definitely want to do that. Two other supplements to help with your brain health and healthy aging. And one of them is coconut oil. Okay, coconut oil has been shown to be directly connected to the reduction of the symptoms of Alzheimer's. And I encourage people to take coconut oil, about a tablespoon as a basic dose in your drink, hopefully every day.
Yeah.
So
I'm going to tell a quick story about that, if I can interrupt you for a minute. That this has been a couple, 2-3 years ago. There was a researcher that came and gave a talk here in the Dallas area, and this is a very limited information. They were just starting some bigger, more wide-ranging research. But there was a lady in Florida who, and if you know, one of the tests for Alzheimer's that they give you is that you draw a clock face, and then they try to get you to put the numbers around it. Okay, so this lady in Florida did it for her husband, and he piled all the numbers down around 5 and 6, and you could definitely tell, you know, he was in some stage of Alzheimer's or dementia. Well, she started giving him 3 tablespoons of coconut oil every day, and within about 6 months, he was able to almost properly align all the numbers. Now, I'm going to, kind of bookmark that with saying that was one person, and she said that, they had started some bigger studies, but, because I used to take it and put it in my, my drinks that I made.
Smoothies.
Yeah, my smoothies. The one thing you just, I think you have to be careful with is that it's very high caloric. And so I think it's like 120, 140 calories per tablespoon. So just, you have to be aware not to go overboard with it. But other thing, coconut oil has a lot of other good uses. Like I've heard dental practitioners say that, rinse your mouth out with it. People use it for conditioner.
Yeah.
I mean, there's a lot of good things. Anyway, I'm sorry. Go ahead. And
in functional medicine, we're not worried about calories, because calories in, calories out is not going to get you healthy or gain weight if you're eating the correct foods. So we tend to not think about that. We want the physiology to be correct. And so if you're doing all of it correctly, that's not an area that we're going to be thought about. Oh, I couldn't remember my blood sugar stuff, so I remember it now. Okay. So chromium. Okay, chromium is sort of the main thing. Chromium, cinnamon, I don't know if I said that or not, and berberine. You can go out and get formulas for blood sugar, support, just basic blood sugar support. There are other things that are helpful, but those are sort of the basics.
Okay.
Oh, awesome.
Yeah,
Okay.
thank you for that.
Yeah, I just was like, I was having a complete, brain fog.
That's my whole day.
Yeah, I just, when
One
you
big
got
brain.
an idea of what you want to say, and all of a sudden there's somebody says, well, what about this? I'm like, wait, I didn't have that. I hadn't thought about that. So I said, I wanted you to do the coconut oil and sleeping. If you've got to try and get enough sleep in order to have your health, it's a foundation. If you don't get enough sleep, that's going to be one of those broken foundations that it's not going to work well. So that's a quick rundown, in my opinion, of things that relate to healthy aging. Was that too much?
That you mentioned that. No, it's perfect. I was just thinking about, for me, the sleep component is so important, because what I noticed, less sleep tends to make me want to eat more, tends to make me not want to go out and exercise, and tends to probably make me be more prone to stress. So for me, one of the key things I have to watch is just getting enough sleep, for sure.
Right. And if you don't get enough sleep, it's going to throw off insulin and growth hormone. If you don't get enough sleep, which is going to mess with your blood sugar, and it's going to mess with your ability to lose weight. So especially sleeping before midnight, and then making sure that you, because that's when one of the cute things I like to say is, if insulin is out to play, growth hormone goes away. Okay, so if you eat a carb, if you eat a carb meal late, like you don't want to eat anytime within 3 hours of going to bed. Okay.
You don't want to.
You do not. And if you eat a carb meal, a bigger carb meal, you want it to be 5 hours. Okay. Because it will mess with your growth hormone, and it will mess with your sleep, and it will mess with your ability to have a good metabolism.
Okay.
Okay.
So that's a lot of great information. No, and I realize that we could do an entire episode on each one of those topics, and then subcomponents of that as well. It's just a lot of information, but I think you've given us a lot of good things to think about. And because that, again, I think you've hit some of the major points that I've got on my list that above my desk is sleep, hydration, drink enough water, which I do not do, but eat right, and then, exercise, move, do something. And, it's all the news reports now are saying that, sitting is the new smoking. So definitely I'm going to have to look into the standing desk.
Oh man,
okay. Yeah. And I've seen them, but I wasn't really sure if, I didn't know about standing up to do work, but it may be something worth giving a try.
Well, you know what? I've been thinking about it, but I don't know about you, but I never sat before in my life. So my hips and my back are like going, what are you doing? So this thing, I mean, I don't know if you can tell, but I'm rising up right now. You guys are, now I'm lowering you. But it's really, this desk at Costco, I have to say, it was for the price. It was big, so I could put my papers on it. You could put multiple screens on it if you need, so it was quite, and for the price, it was good.
Interesting. Okay,
that's awesome.
Check one of those out. Well, I think we've taken about as much time from you as we can today. We appreciate it, and as always with you, we will make the invitation that we would love to have you come back on and start unpacking a lot of these foundations kind of a little bit deeper. Maybe we take one or two at a time and just see where we go with that. But thank you so much for taking time out of your day. If you don't mind, one question we usually ask is, so what is something that you do during the day? And it could be an app or a habit, something that you use that kind of adds value to that healthiness or wellness factor for you.
Well, right now, well, I said right now the standing desk is like my excitement, but also
Okay.
This is hard. This is hard for all of us. Taking time to go, I'm going to take a certain amount of time to get off my butt and do something every day. Okay, so I have a friend, a physician friend of mine, and every morning at 7:30, we're meeting on Zoom and we're exercising for 20 minutes.
Awesome.
Okay, because doing it on your own may be harder. And so we both look at each other, our hair's all messed up, and we're like, but we're doing it. So honestly, it's like when it's over, it's like, okay, I did it.
Yeah.
Okay, I did that thing. And the other thing, and Roy, you said it too, I have bottles or glasses of water wherever I go. I have, this is holds about 20 ounces. I want to make sure I got water everywhere because I want to hydrate.
Right.
Yeah, it's important. And the exercise portion, of course, we always tell everybody, be sure and check with your doctor for your individual plan or what you can and can't do. But I think there are so many options out there, chair aerobics, there are things geared to most any situation. And, another thing that I just got that I'll share this weekend was it's a TRX band. So basically, you can do different body weight resistance training on it. And so, what it has allowed me to do is, in the middle of the day when I'm feeling like that, like I need to stand up, I can get up, just walk over there, maybe do 5 minutes worth of stuff, nothing heavy, but it is movement and it is getting me out of the chair. So, there's a lot of great things out there.
There's a lot of new, I think the world has finally discovered the largest population growth is seniors. If you go to Facebook, there is so many senior exercise programs right now. Lots of them.
Yes.
Yeah.
Oh, I have been getting those ads popping up left and right. I'm a little offended that they think I'm old enough for these ages,
but you know what?
For these ads, but
they're not all easy by a long shot.
No, but they're cool. I mean, who would have thought of some of these things?
Yeah. So we've been experimenting with various ones.
Yeah, and it's just good to get up and move, and not only for me, like the weight loss portion, but just for our health and mental well-being. It's good to get up and move during the day, throughout the day.
Definitely.
Plus it leads to me sleeping better as well.
Yeah, definitely. Yeah. So I also wanted to say, for anybody who's interested, I am offering a free 15-minute consult if you want to try and find out some of why you may be having health challenges or trying to prevent yourself from having health challenges as we age. I'm offering a free 15-minute consult.
Okay, that's awesome. We appreciate that. And I was just fixing to ask you if you could, tell people who you work with, what you can do for them, and then, of course, how they can reach out and get a hold of you to work with you.
Well, I work with people of all ages, but as I am aging, the people I'm drawing are often also aging. So I would say from 45 up, I have 90-plus-year-old patients as well. But the people who are trying to say, I want to address my health from a different point of view. They want to go deeper, and that's really the kind of person who says, I've tried these things and I'm not really getting the results I want. Let's try something different. Those are the people who are drawn to me. So if you want to reach me, you can call my office, and I can give you the phone number, which is 831-476-6906, and let my staff know that you heard this podcast and are wanting your 15-minute consultation. We're going to find out, what have you done for your health? What's worked? What hasn't worked? Talk to you about what I do, and see if this might be something you want to investigate further. Or you can reach me through my website, which is drcarolschweri.com, DrCarol SHWERY.com. You can reach me through that portal as well.
Yeah, and we will be sure and put all that information on the show notes where people can find that as well. So, all right. Well, thank you so much for your time. We certainly do appreciate it. Of course, we appreciate all those listeners as well. If please share with your friends and relatives. This is some great information that everybody of all ages needs to hear. It's never too early to start taking care of our health to help us live better through those latter years. So also, you can find us on Apple Podcasts, Google Podcasts, Stitcher, Spotify, all the major platforms. You can find us at our website at www.AGEUcational.com. And of course, the video of this interview will go up on YouTube as soon as the episode goes live. So until next time, Dr. Carol, again, thank you so much. We appreciate all of it. Good information, and we can actually gave us some actionable items we can take action on to start helping ourselves.
Going right now. I'm cracking my whip.
Great. Thank you so much for having me.
All right. Yeah,
Thank you so much for coming back and sharing all that information. Yeah. That's awesome.
All right. Until next time, y'all take care of yourself and take care of your families.